Hello, my name is Michelle Fox. This is my presentation entitled Jake's QI Project. The person that we interviewed is named Jake Schlottman. He's the facility administrator of a skilled nursing with 70 beds. He was unable to provide a filmed sitting interview in one block of time, but he was able to answer small sets of questions over several sessions regarding a quality improvement initiative that he initiated. I assembled those answers given in small sessions into one congruent presentation, which you'll find here. So in my mini sessions with Jake, we covered several topics, included what were the actual qualities for a collaborative team effort. We approached what his need was that made him make a quality improvement initiative, what approach he took, who the participants were, the challenges, conflicts, and how he overcame them. And finally, we discussed the results of his initiative. The first topic we discussed were qualities for collaboration, and there were several questions that we presented to Jake. The first question was, what skills do you consider the most important developing a collaborative team approach to healthcare? And Jake had three answers. He said, first, leadership, specifically the ability to get people to buy into an idea and make it their own. Harry Truman said leadership is the ability to make men do what they don't want to do and like it. The second topic was organization. He said, you must present clear objectives and each team member must have clear responsibilities. People need to know what they are expected to contribute. And his third answer was standards. There must be pre-agreed upon indicators of when the goal has been reached. We next asked Jake, what was the actual need? Why did you have to do a quality improvement initiative? His answer was that there was a need for an improved admissions process. So I probed a little further. I asked him, what were you trying to accomplish? Why was it important to improve? Who were the stakeholders? And could you give me a process analysis of your changes? And Jake's answer followed as this. He said, we were trying to increase employee retention rates. Ours were suffering due to nurse burnout. We were also trying to reduce overtime because on nights when we had 5 admissions, a single RN could work from 3 p.m. to 5 a.m. on those days. Why was it important to improve? Because finding and retaining nursing talent is difficult and expensive. Nurses who feel burned out sometimes provide poor customer service. And who are the stakeholders? Well, ultimately the patients are. They have the right to expect a quality admission process where history and assessment are accurately gathered so that nursing department can plan and execute proper interventions. And then he discussed his process analysis. He said the admission process was changed from one in which an RN is responsible for every act of an admission. In the past, they signed the paperwork from the transport company for a patient receipt. Then they called and clarified all the hospital discharge med treatment orders. They did all the data entry to put things into the EMR. They made appointments for future follow-up with surgeons and specialists. The new process he initiated involved giving the entire nursing team of RN, LVN, CNA small pieces of an admission over more than one shift. For example, the RN would be responsible to confirm all the meds with the doctor and enter the meds into the EMR. An LVN would start care plans, while another would give the TB test and get consent signed. The CNAs even helped. They would complete the personal belongings list, and they took a diet slip to the kitchen. An admissions checklist was created, and each person was assigned a specific color-coded section to work with. They were asked to initial their section when their tasks were complete. It was a complete revamp of an old, broken-down system. Next, we delved a little deeper into who actually made contributions on Jake's team to this new admissions process. And his answer was that case management, social services, the actual admissions department, staff development, nursing, all contributed. Dietary contributed. Physical therapy contributed. It was an interdisciplinary team effort to give a patient the best start at a new facility that we could possibly provide. Then I asked Jake, what do you see as the distinct and collaborative contribution of different roles to patient care? And what can be garnered by using more than one discipline when you make a policy change like this? What are the standards for effective teamwork? What are the positive and negative effects? When I asked Jake, what do you see as the distinct and collaborative contributions of different professional roles to client care among your team members? His answer was pretty succinct. He said, each separate department gives distinct collaborative contributions to patient care. For an example, case management does not do physical therapy. That's not their specialty, but it does order the front wheel walker the patient will use at home, which does affect physical therapy. Another example would be that administration does not do clinical patient care, but by finding a more effective nurse admission process, they contributed to the efficiency of patient care. Everyone has a specialty, but our individual work sometimes directly affects another discipline. Then I asked Jake, did you encounter any blowback, any conflicts, any obstacles in bringing your new proposed admission process to fruition? I asked what kind of conflicts occurred, barriers that he experienced implementing the project, who was the champions and adopters and who were not, and what methods and strategies did he use to handle those conflicts through interpersonal negotiation. Jake had a lot to say about receiving rigidity and non-assertive nurses giving problems to him about this project. He said, nurses set in their ways were initially resistant to making adaptations to their thinking. Some of the nurses who resisted change had poor social skills or poor administrative skills. These changes we were proposing would require a charge RN to choreograph an admission by making specific assignments to other nursing staff. It would require them to delegate and follow up for compliance. A non-assertive nurse would struggle with asking people to do things for them, and a nurse with poor people skills might come across as too bossy or pushy, isolating the very people they need to get on their side. As far as who was champion and adopters, younger, more tech-savvy nurses were the first to buy in wholeheartedly. Nursing was, of course, a huge buy-in because their department was the one with the most to gain with increased morale and employee retention. But the process had its detractors too. Med records used to be able to just audit one person if something didn't get done properly on the admissions process. Now they had to track down 3 or 4 nurses. There were nurses who were used to getting a lot of money in overtime, and they would frequently defy instructions and would work until 5 a.m. because they refused to delegate. And then there was someone else who just had poor time management. But all in all, we did overcome those objections. And we did overcome those objections, he said, by interpersonal negotiation. The first method that the team used is they sought the buy-in from the nurses by trying to persuade them to focus on how much less work they are held accountable for under this system. We emphasized that having more free time away from work was essential for self-care. We also modeled the process for them by an expert nurse to show that the method is very effective and it reduces stress and time it takes to do an admission. And then finally, we asked Jake about the results of the proposed changes, the rollout, and how things actually were affected when the new policy became effective. We asked him again, how did you know if the change was an improvement? And he went back to something he said at the beginning when it asked what standards were there for collaborative improvement. He answered, I said having standards which measure when success has been attained is important in developing a collaborative team approach to organization. For us, we would consider the change initiative to be a success if we accomplished reduced overtime and reduced workplace burnout. And then his final answer was, the end result of our initiative was a dramatic reduction in overtime paid to an admissions nurse. There were occasional times when a nurse would have to stay because an admission came after 10, close to the end of a shift, but on the vast majority of time, overtime was reduced from 5 or 6 extra hours to 30 minutes or 15 minutes on a night with multiple admissions. Additionally, we noticed that the charge RN did seem more refreshed after our charges were implemented. And in conclusion, I'd like to say thank you and thank Jake for all the time he gave me so that I can do this project. I do have references attached to a hard copy that's provided via attachment with this presentation.